final
Brought
guest
to you
for
by
today.
Barber Behavioral Health, a service of Barber National Institute.
Yeah, Cecilia Hollins is with us today. She's the Director of Clinical Programming at Barber Behavioral Health. Thanks for coming back here to First at 4.
Thank you for having me.
Yes, and today's topic, we are talking about mental health disorders. We're going to start with anxiety.
Sure. So anxiety is one of the more common mental health diagnoses that we see in the United States. And it's important to know that anxiety in and of itself is not bad. Sometimes anxiety can be helpful. It alerts us to danger and it helps us take action. But it becomes a problem when it's persistent and excessive and starts impairing our daily functioning. So some of the things that you want to be looking out for when it comes to anxiety is persistent feelings of apprehension or dread, persistent worrying, as I said before. And then usually we'll see a little bit of a mix of physical symptoms as well. Oh. And that might look like insomnia, lack of appetite. It could also be like racing heart or feeling like maybe you're having a heart attack. Sometimes those can be indicators that you're experiencing severe anxiety as well.
And I think this next one is interesting, depression. And around our area, we can see seasonal depression. So when to know if it's, explain.
So yes, in Erie, we are especially prone to seasonal affective disorder because we live so much of the year in the dark.
Yeah.
So, the research shows that there's some type of chemical change that occurs in our brain when the days are shorter and there is a lack of sunlight. But in general, the symptoms of general depression as well as seasonal depression are similar. So we would see, of course, feelings of sadness, lack of interest in activities that we used to enjoy, and feelings of isolation. And that can be really problematic because when we're depressed, our tendency is to isolate when really we know what pulls people out of depression is to reach out and seek that support from people who we love and trust. So, and then we might also see some of those physical symptoms as well, weight gain or weight loss, insomnia or sleeping too much, general appetite disruption. So it's usually a little bit of a mix.
And then what can also tie into all of this is drug and alcohol abuse.
Yes, so that can be a common way for people to self-medicate. The problem is, of course, that substance abuse in the immediate and in the long term tends to exacerbate whatever mental health symptoms we're experiencing. And some studies actually show that it can worsen the progression of certain types of mental health disorders. So it's really important that if you're experiencing substance use disorder, that you seek professional help because there are some real safety risks associated with trying to withdraw from something on your own.
And I would imagine for a lot of people, they're just not sure when to reach out. So like you said, you know it's a problem when it's kind of impeding on your daily life, right?
If you're finding that you're having a hard time getting out of bed in the morning, that you're feeling these pervasive feelings of hopelessness, helplessness, and worthlessness, those are all signs that you need to reach out and seek some help.
Yes, and where can we find great help in this area, right? Through Barber Behavioral Health.
Yeah, of course, we're always happy to connect people to resources that they need. We've talked before about how Erie County is really rich in mental health resources as well as drug and alcohol resources. So there are tons of avenues to choose from. Sometimes it's easiest to just start with your primary care physician.
Yeah, or start here.
Yeah,
I mean,
call our
sometimes
care
all
coordinator.
people just need is one number, you know, to reach out, and this could be a good place to start. We'll post this number every week.
Perfect.
As we sit down and talk with Barber Behavioral Health, focusing on your mental health.
Thank you so much.
Thanks,
Cecilia.
Cecilia.
All right.
Okay, we'll be right back.